So when we don't transition to care very effectively, the consequences are obviously quality. Quality suffers, and of course higher costs. If you get readmitted to the hospital, that's one of the measures. Probably the most common measure is 30-day readmissions for heart failure patients, for instance. That costs a lot of money, and of course it has a significant impact on the cost of healthcare and the quality of healthcare. So when that heart failure patient gets discharged and they go home and grab a bag of potato chips and they're back in the hospital a few days later, that's not good for anyone. And those are the kinds of things where we have to have a greater oversight of what's happening with our patient population. And one of the hardest things in the world to do is change behavior, change somebody's health behavior. It's very, very difficult. As a matter of fact, this is old research, but Padell's rule of 1/3 said that about 1/3 of the patients follow a physician's prescription completely, about 1/3 follow it partially, and about 1/3 doesn't follow it at all. And that's sometimes a surprise for physicians and other providers, that patients are not really very good at following their prescribed regimen. So we need to learn how to manage that better, and it's an art and a science. There's a science to it, no doubt about it, but there's also an art to it. And I think that's something maybe is not taught in medical school, but I think that's something that our providers are going to have to get better at, is how do we help people change their behavior? Very, very difficult to do.
There are consequences for our failure to provide good information and to assure good transitions of care. Obviously, there are the obvious ones of medication errors, of difficulties with complications, because we've not taught the patients and their families those items that help to make it very straightforward. Oftentimes, those errors lead to unnecessary testing. Sometimes those errors lead to real complications. Also, the inability of the patients and their families to understand what is occurring often leads to them returning to hospital where they are readmitted. It's extremely difficult for the emergency department to see a patient at 9 o'clock at night, 3 days after hospital discharge, having suffered a heart attack 5 days before, and not have them be readmitted to hospital. That helps to lead to our spiraling costs. It helps to increase the tremendous expense we are already exuding for our care. And so the provision of that education, the provision of good information during the care transition results in a tremendous reduction in the cost of our care in general.